I try to emphasize the fact this is an incredibly highly contagious disease. It is a disease with real morbidity and mortality. People die of measles, and it's fully preventable, and so that we as primary care types need to, every patient we see, think about the fact, has this person been properly protected so they don't get measles, because it can be reintroduced into this country as it was in Disneyland. Correct, right. And it's become now a travel vaccine, because even though there aren't that many cases in this country, there's 20 million or so internationally, and so if one is traveling, one probably should be vaccinated for measles, get their second dose. There have been, in the last several years, between 30 and 50,000 cases in this country. Not a trivial disease. It's potentially fatal in neonates and infants, but in adults it causes a drive you crazy cough for months, and with consequence of that, people get broken ribs. They're incontinent from this coughing. And it's preventable, and the CDC has called attention to that by recommending that everybody, and that means everybody, get a Tdap booster, and that every pregnant woman gets a vaccine with every pregnancy. I think people are particularly emotionally susceptible when they're pregnant. They're more likely to do what I would call the right thing, but others might argue. And I think almost all obstetricians are aware of this. And the vaccine has no side effects. It's not a live vaccine, and there's no downside to getting it. There's clearly an upside in terms of protecting one's newborn. And so much so, again, that it's recommended for every pregnancy, the last trimester.